Hi, my name is Adam Jaratanian, and I'm the co-founder and CEO of Bright Paths Recovery in Los Angeles. Today, I want to talk specifically about alcohol addiction treatment because alcohol affects the body and brain in ways that often go misunderstood. Many people don't realize how deeply alcohol use can impact physical health, emotional regulation, and the nervous system until stopping feels overwhelming or even frightening. If that's where you are, you're not alone, and help is available. Alcohol is a central nervous system depressant. Over time, the brain adapts to its presence, changing how it manages stress, sleep, mood, and anxiety. When alcohol use becomes consistent or heavy, the body can begin to rely on it to function normally. That's why stopping suddenly can feel so destabilizing, both physically and emotionally. This isn't a lack of willpower. It's a physiological process that requires professional care. One of the biggest concerns with alcohol addiction is withdrawal. Alcohol withdrawal can range from uncomfortable to medically serious, depending on usage history and overall health. Symptoms may include anxiety, tremors, sweating, sleep disruption, nausea, and emotional distress. In some cases, withdrawal can involve elevated heart rate, confusion, or other medical risks. This is why alcohol addiction treatment should never be approached casually or without support. The alcohol withdrawal timeline varies from person to person, but symptoms often begin within hours after the last drink and can intensify over the first few days. For some individuals, this early period requires close medical monitoring to ensure safety and stability. As the body begins to rebalance, symptoms gradually decrease and mental clarity starts to return. Having the right clinical support during this time makes a meaningful difference. At Bright Paths Recovery, alcohol addiction treatment begins with a comprehensive assessment to understand your drinking history, physical health, mental health needs, and personal goals. When appropriate, we provide medically supervised detox to help manage withdrawal safely and comfortably. Our clinical team monitors symptoms closely and adjusts care as needed, supporting both physical stabilization and emotional reassurance. Detox is an important first step, but it is not treatment by itself. Once stabilized, clients transition into our residential alcohol addiction treatment program, where the deeper work of recovery begins. Residential treatment provides a structured, supportive environment where individuals can focus fully on healing without outside distractions or triggers. Therapeutic work during alcohol addiction treatment is grounded in evidence-based care. We use approaches such as cognitive behavioral therapy, dialectical behavior therapy, motivational interviewing, and trauma-informed care. These therapies help individuals understand the emotional and behavioral patterns connected to alcohol use, develop healthier coping strategies, and rebuild confidence in daily decision-making. Many people struggling with alcohol addiction also experience anxiety, depression, trauma, or chronic stress. That's why Bright Paths Recovery offers integrated dual diagnosis treatment addressing mental health and alcohol use together. Treating both at the same time supports more stable recovery and reduces the risk of relapse. Alcohol addiction treatment also involves restoring physical health and daily balance. Nutrition, sleep, and routine play a significant role in how the brain and body recover. At Bright Paths, clients receive chef-prepared meals designed to support physical restoration, along with a daily structure that promotes stability, accountability, and self-care. Our Los Angeles setting offers a refined, comfortable environment that supports healing without relying on exaggerated luxury or unrealistic promises. Family involvement is another important part of alcohol addiction treatment. Alcohol use often affects relationships over time. When appropriate, we provide family education and counseling to improve communication, rebuild trust, and strengthen long-term recovery outcomes. As treatment progresses, we focus on relapse prevention and aftercare planning. Recovery doesn't end when residential treatment concludes. Each client works with our team to develop a personalized plan for continued therapy, support, and long-term stability beyond treatment. Our alcohol addiction treatment program in Los Angeles is designed for adults who want structured, compassionate, evidence-based care. Whether this is your first time seeking help or you've tried to stop before, professional treatment can provide the support and clarity needed to move forward. If alcohol has started to control more of your life than you want to admit, reaching out can feel difficult, but it can also be the beginning of real change. Our admissions team is here to listen, answer your questions, and help you understand your options with respect and care. At Bright Paths Recovery, we provide thoughtful, evidence-based alcohol addiction treatment designed to support safety, healing, and long-term recovery. When you're ready, we're here to help you take the next step.